Welcome to Friday's edition of COVID-19. For the third straight day, Korea's daily caseload is hovering dangerously close to the 700 mark. Authorities warn the caseload may jump past 900 a day starting next week if people continue to venture outdoors with little regard for social distancing guidelines. I have our Kwon standing by with more on that warning. Now, so do start us off with the case here in Korea then.
Sure, Sunny. Now, this third wave of the pandemic here in the nation could become a longer than expected outbreak and also one of a larger size. This Friday's caseload was the highest figure so far reported in the third wave of the pandemic here, concentrated in the capital region. 689 was the number tallied, which is the highest since late February when we had 909 infections. And with a drop in imported cases today, we have higher infections here domestically, standing at 673, so in the upper 600s as well. Now, out of those, we have 512 infections in the metropolitan region, with 200s in the capital Seoul and Gyeonggi-do province, double-digit figures in many other parts, especially a concern also here in the southern part in Ulsan and Busan as well. And these are breaking out at nursing homes, schools, restaurants, as well as gatherings among friends and families. Now, if you go over to our figure now here, 40,786 is the total accumulated number, and we also have 8 fatalities just like yesterday. So we are seeing now much higher fatalities than in recent weeks before, and the number of people quarantined for the virus has also surpassed 9,000. And if we take a look at the developments over the past week, last Friday it was when we hit the 600s. That was when we had 629 infections and now 689. So we are inching closer to 700.
Right. So I believe these alarming numbers are also casting a bit of a shadow on current containment efforts.
Right, Sunny, and which is exactly why officials are now focusing on expanding tests as well as hospital beds. 150 temporary screening centers will be set up for more massive and more streamlined testing. Our Songyeon will go into the details in our next segment when it comes to that. But authorities stress, though, that right now it's really also up to each and every individual to follow social distancing, especially over the weekend, meaning no socializing, warning of a worse situation.
If we cannot stem this outbreak now, we have no other choice but to raise social distancing measures to level 3, which would mean a complete suspension of social activities. Such action would incur social and economic losses that are incomparable to what we have experienced up to now.
And now let's shift to the international figures. A new milestone has been hit as we have a total of over 70 million infections and a pretty unusual daily caseload of almost 1.5 million. Also, that's why we also have a higher than usual recovery rate as well. And that is, let me explain that by taking a look at our major outbreaks here. We have Turkey suddenly jumping up to become the country with the 8th highest number of infections around the world between Italy and Spain. And that is because we are seeing a 5-fold jump from April, because Turkey's health ministry announced the total number of infections, including asymptomatic patients, for the first time on Thursday. So let's take a closer look at the details. That explains why we have over 800,000 new infections in Turkey. Of course, that did not happen in the span of a day. Meanwhile, also European countries are seeing more than 20,000 infections a day, including UK, Italy, and Germany, and the US, almost 220,000 new infections. And those are the figures I have for now. I'll see you back on Monday. Back to Sunny.
All right, so thank you for that. Authorities here in the Greater Seoul area are expanding their testing capacity and offering this service free of charge to all. Now, those hoping to get tested need not disclose their personal information, just a contact number for the test results. I have our Kim Songyeon here in the studio with details on that. Welcome, Songyeon.
Good afternoon, Sunny.
Right, so tell us more about the plan to expand public testings in the metropolitan region.
Right, Sunny. So over the past several days, we have been seeing nearly 700 new daily infections here in the country. And some 70% of that total were cases coming from the capital region encompassing Seoul, Incheon, and the Gyeonggi-do province. Now, in order to stem the latest outbreak in this region, especially, the government is easing requirements on screening to allow anyone to get tested for COVID-19 free of charge. Now, health authorities said they will expand testing for 3 weeks in the Greater Seoul area starting next Monday to curb the flare-up of new cases in the densely populated region. The government's new guideline will allow anyone to get free testing when level 2 or higher social distancing measures are in place, regardless of whether or not they have suspected symptoms. Earlier this week, President Moon Jae-in called for expanded testing and more thorough tracing as the country struggles to control its latest and largest wave of infections. Yoon Tae-ho, a senior health ministry official, said in a Wednesday press briefing that the virus is continuing to spread in the Greater Seoul area despite heightened social distancing guidelines, and he expressed worries that this may be a sign of patients with little to no symptoms unwittingly infecting others in everyday settings. Now let's take a listen to what Yoon had to say in a briefing yesterday.
The government plans to expand coronavirus testing in a preemptive and aggressive manner in order to minimize the spread of non-symptom infections as well as latent infections.
Hence, the main goal of the government's expanded testing is to find the so-called silent spreaders who experience little symptoms and are well enough to go about their daily lives.
Song-yeon, I understand these measures come amid calls for concerted efforts from the Blue House.
Right, Sunny. Earlier this week, President Moon Jae-in ordered the government to mobilize every available resource out there, not only to expand testing, as I did mention, but also to track infections. Now, he mentioned that if necessary, public servants will also be mobilized for the task, including military and law enforcement personnel. Now, President Moon also said screening centers should operate longer hours to allow people who work to get tested more conveniently, and more drive-through test centers should be set up as well. Now, on this note, Health Minister Bang Nung-hoo emphasized that the authorities are bringing all their available resources to bear upon this task to tame the latest outbreak.
The government is mobilizing all available resources to block the spread of COVID-19 in the Seoul capital area, which has become the epicenter of the third wave.
Moreover, while presiding over a meeting of the Central Disaster and Safety Countermeasure Headquarters Wednesday, Prime Minister Chung Se-kyun called on health officials to focus all resources on the Greater Seoul area. He said the capital region has emerged as a key battleground in the latest outbreak, saying heightened social distancing measures weren't enough to stem the tide. The authorities are currently working on details to allocate the necessary manpower to operate the new test centers and where to set them up.
So how many testing sites, temporary testing sites that is, are being set up, Song-yeon?
Right. Authorities, they said about 150 new screening sites will be set up in the Seoul metropolitan area. Now, anyone who gets tested at public health centers with a designated testing site and also at temporary sites within university hospitals and private medical facilities as well. Now, some 150 test centers will be operating for the next 3 weeks starting Monday, and some will be in locations where many young people tend to gather, like places near university campuses. Currently, there are 211 designated test centers in the Seoul metropolitan area, including 69 in Seoul, 110 in Gyeonggi-do, and 32 in Incheon, not including the 150 test centers being newly added. They will operate on extended hours until 9 p.m. on weekdays and until 6 p.m. on weekends, and you can get tested anonymously simply by submitting your phone number and no other personal information. The test centers will administer the standard RT-PCR tests along with a couple other testing methods that one can choose from. They include saliva tests and antigen tests, with the latter capable of delivering results within just 30 minutes after the test, compared to the many hours needed for the standard RT-PCR testing.
That's quite convenient. All right, Song-yeon, thank you for that coverage. See you again next week.
Thank you for having me.
Right, a key part of Korea's COVID-19 containment campaign is the enforcement of a 14-day quarantine for all arrivals into the country. Accordingly, to ensure safe travel from Incheon International Airport to designated quarantine locations, Seoul City, for its part, is operating a special fleet of taxis. I have our Jessica Lee standing by. Hello, Jessica.
Hi, Sunny.
Right, Jessica, I see you are at the airport.
Yes, I'm reporting live from Incheon International Airport. The reason why I'm here today is to take a look at how overseas entrants who arrive in Incheon International Airport make their way to COVID-19 screening centers. Once they arrive to get tested for the virus with a minimum contact with others, a taxi is one of the most recommended means of transportations. Therefore, from last April, Seoul Metropolitan City has been operating a quarantine taxi with a taxi company. So let's see what procedures people have to go through to use this service. So as you can see here, this desk is for COVID-19 free taxi. And before I get on the taxi, you have to write down all of this information, your time and name and contact number and also your destination. So after filling in this information, now you're able to get on a quarantine taxi at the designated boarding area in the passenger's terminal. The advantage of using this quarantine taxi service is that you don't have to take public transportation where it has a higher risk of mass transmission due to packed people in small spaces. And this can reduce the risk of transmissions as well. So I heard that currently there are about 200 quarantine taxis in operation, and I will try one of those. Good afternoon.
Hi, how are you?
I'm good. How are you?
Yeah, nice to meet you.
Nice to meet you too. This is Mr. Tae-sik, who will take me to a final destination safely. So let's go outside. And before we get on the taxi, I have a question. So how are you carrying out virus prevention measures for passengers before and after boarding?
Okay, the driver is required to wear a mask and glove like this all the way. Also, we always, sterilize our hand after moving, luggage or pay bills. Also, we sterilize the car inside, outside, right after, passenger leave the car.
Thank you so much. I can definitely tell that you're working very hard, thoroughly, when it comes to disinfection work. So let's go inside the taxi and take a look at how and what sort of virus prevention measures are being carried out here. Thank you. So let's take a look at the taxi now. So as you can see here inside, plastic dividers are installed between the passenger seat and also driver's seat, and hand sanitizers and face masks are equipped for the passengers who are using this service. And it is said that on average, about 200 passengers are using this quarantine taxi per day. It is very convenient and safe at the same time because passengers can use the service from the airport to COVID-19 screening centers, but also from screening centers to their destination for 14 days of self-quarantine as well. Moreover, from April to November, about 55,000 passengers used this taxi services, and 5 of them tested positive for the virus. However, thanks to thorough virus prevention measures, there were no additional confirmed cases or secondary infections. However, still working in a situation where important cases are constantly emerging. I have another question. Do you have any concerns about the secondary infection?
Okay, yeah. Of course, I'm a little nervous, but we are operating with minimal contact and communication with the passengers. And we are doing our best on both taxi driver and passengers, to keep safe by taking, maximum preventive measures.
Thank you so much. Now, why don't we get in the taxi?
Okay, let's get in the car.
Thank you. As you might have noticed, there are many brave workers who are working in various fields who devote themselves to combat against the COVID-19 virus. And it's very important for ourselves as well to follow our personal hygiene guidelines to overcome this obstacle altogether. And this has been Jessica Lee reporting live from Incheon International Airport. And back to you, Sunny, in the studio.
Right, Jessica, have a safe trip and a very big thank you to all the drivers there for their dedication. Right, meanwhile, for more on the city of Incheon, I have Peter Bint with me here in the studio. Welcome back, Peter.
Good afternoon, Sunny.
Now, I understand part 6 of our special coverage of Korea's free economic zones takes us to the port city of Incheon today.
Yeah, that's right. The Incheon Free Economic Zone, known as IFEZ. It was actually the first free economic zone to be designated in Korea in 2003. The zone actively attracts investment to the Incheon metropolitan city and surrounding areas. Incheon is near Seoul, the capital of Korea, and the Incheon International Airport is a major gateway for commerce and travellers. As 40% of the city's total area is green space, it's also a very pleasant place to live thanks to the harmony between nature and the city.
Right, Peter, I believe Incheon was Korea's first free economic zone and has been regarded as a success story.
Yeah, especially in terms of attracting investment, right? In terms of foreign direct investment, known as FDI, from IFEZ alone, last year it accounted for 70% of the combined $18.3 billion in investments that the 7 free economic zones in Korea attracted. The number of people working in the IFEZ was only around 25,000 in 2003, but has soared to 380,000 people as of August 2019. And the number of foreign invested companies also jumped from 3 to 146 companies, while the number of tenant firms rose to 3,400 from just 673.
It's quite an achievement. But investments this year, Peter, have been minimal.
Of course, due to COVID-19, like with other industries, IFEZ has been hard hit. They set a target of attracting $656 million in FDI this year, but only reached $30 million by August of 2020. So, in order to overcome this, they have used online video conferencing to give investment briefings as part of their efforts to expand investments. And they have since had great success. Currently, the amount of FDI reported so far is $547 million, which is about 83% of their annual target. And this is a significant achievement as the global economic growth has slowed down and investments have declined in Korea and abroad as well.
So, Peter, which industries is this particular zone looking to support?
Well, biohealthcare is a big one, and also high-tech parts and materials, integrated resorts, distribution, and the logistics industries, as they are often held up as innovative growth ones. Let's now take a closer look at the IFEZ, which is preparing to lead new growth in the future. IFEZ was Korea's first free economic zone and played a leading role in this respect. For 2 consecutive years, the Ministry of Trade, Industry and Energy rewarded IFEZ with the highest grade in a performance evaluation of free economic zones.
그동안 투자 유치 등에 있어서 선도적 역할을 해왔고, 특히 지난해에는 그 한국판 뉴딜을 만드는 그 스타트업 파크 사업의 착수, 그리고 송도 바이오 클러스터의 확대 조성, 미국 스탠퍼드대 스마트 도시 연구소 유치 등 혁신 성장을 한 노력이 평가를 받은 것으로 보고 있습니다.
IFEZ encompasses Songdo International City, where tech firms, biotech firms, global educational institutions and research infrastructure are established. And Yeongjong International City, which is a mixed-use development comprised of aviation logistics, tourism and leisure centered on Incheon International Airport. As well as Cheongna International City, a hub of international finance, distribution centers, medical care and high-tech business.
아무래도 수도권에 있다 보니까 좋은 인력을 확보하기가 쉽다라는 것이 있겠고, 두 번째는 인천공항, 그다음에 인천항만, 그다음에 철도, 도로교통망이 굉장히 잘 돼 있습니다. 그래서 해외에 그 수출하고 또 자재를 원재를 받고 하는 게 굉장히 유리하고요.
Rapidly responding to dynamic changes occurring in Asian markets, the IFES is situated in the middle of the Northeast Asian Economic Zone and within reach of 147 cities by plane in under 3 hours. Each of these cities boast a population of over 1 million people.
바이오, ICT, 그다음에 관광, 물류 등 그 첨단 산업과 서비스 산업을 또 적극적으로 유치해서 이 아이패즈를 4차 산업을 선도하는 그러한 탄탄한 산업 생태계를 구축해 나갈 계획입니다.
So what plans are in the works to attract investments post-pandemic, Peter?
Well, alongside Chungbuk and Daegu Gyeongbuk Free Economic Zones, the IFES is also making a strong push into the biohealthcare industry, which has risen in importance due to COVID-19. Songdo International City has formed a global biohealthcare cluster that boasts a production capacity of 560,000 litres of biopharmaceuticals, which is the world's largest output for a city.
I hear a training centre is also being set up in the area.
Yes, recently the Bioindustry Manpower Training Centre, which is a state project to train skilled workers in the biohealthcare field, is slated to become a tenant, and it will be the third training centre of its kind in the world and the first one to be established in Asia. In addition, the city has been given the designation of a bioconvergence industrial technology complex, and this will be a part of a specialised biotech industrial complex that will create a business structure supporting R&D and exports.
And what is the current status of biotech firms in Songdo?
Well, they house two of the big ones on the Kospi, Samsung Biologics and Celltrion. They are anchor companies in Songdo. And about 60 biotech firms and research labs are clustered together in the city, and there is a robust exchange of ideas and know-how between them. In addition, Samsung Biologics is planning to build a fourth plant which will have the world's largest biopharmaceutical production capacity for a single plant, and Celltrion also announced recently that it will construct a third plant.
So why are these biotech firms choosing to be at Songdo?
Well, we met with one such company in Songdo, in the biohealthcare cluster, to find out a bit more about this. Let's take a look. Cytiva, a global biotech company. Cytiva provides biopharmaceutical companies with cutting-edge products used in innovative bioprocessing and the production of biopharmaceutical drugs while supporting the development of new processes, various training and technologies that clients need.
사이티바의 고객사는 생명과학 분야의 기초연구, 혁신적인 백신, 바이오의약품, 그리고 최근에 개발이 가속화되고 있는 세포 및 유전자 치료제 개발에 매진하고 있습니다.
The B2B business that Cytiva is engaged in is structured in a way that customers grow together with Cytiva. The company continuously develops innovative technologies to increase the productivity of pharmaceutical products through close collaboration with customers. As a result of these efforts, more than 75% of biopharmaceuticals approved by the US Food and Drug Administration last year utilized Cytiva's technology. As Cytiva is growing as a global biotech company, why did it choose to move into Songdo?
송도는 국내 고객사가 접근하기 좋은 위치인데다가 공항이 가까워서 아시아 태평양 지역 센터로서 최적의 입지라고 할 수 있습니다.
Since many leading South Korean biopharmaceutical companies are settling in Bio Valley, Cytiva cites this as an environment conducive to growth and a big investment factor.
Right. And what are the prospects for Korea's biotech industry, Peter?
Well, during the past 2 decades, it's really achieved some impressive growth. So beginning in 2010, domestic biopharmaceutical production has steadily grown by about 9% every year. Korea has garnered attention as an ideal place for biopharmaceutical research and production during this COVID-19 pandemic. Experts predict that Korea's biopharmaceutical market will achieve a high growth rate of over 10% every year, as it is bolstered by a sizable market, strong industry base, and solid expertise, coupled with a good investment environment.
Peter, one final question before I let you go. Aside from biotech, what other businesses is the zone focusing on?
Well, we've mentioned it a few times, the fourth industrial revolution, and they're looking to do that through integrating advanced technologies. The Songdo high-tech industrial cluster is being created to connect Korean and international firms that boast world-class information technology, biotechnology, and nanotechnology. Not only are Yeongjong and Cheongna providing support to the robotics, drone, and advanced vehicle businesses, but they have also established training centers and engineering centers to produce skilled workers for the aviation industry.
That's good to know. All right, Peter, as always, thank you for the coverage. Have a safe weekend.
Always a pleasure. Thank you.
급격한 확진자 수 증가로 인해 의자나 방역과 의료체계의 역영향이 한계에 다다를 수 있는 위태로운 상황입니다. 중환자 병상과 생활치료센터 등도 빠르게 확충하여 확진자가 즉시 필요한 격리 치료를 받을 수 있도록 하고
The resurgence here in Korea is looking to stretch the local medical capacity to its limits as daily cases continue to soar despite the tougher distancing guidelines currently in place. Now, for more on this, I have Dr. Yoo Byung-wook from Suncheon University Hospital. Welcome back, Dr. Yoo. And I also have Professor Chung Sun-jae from Yonsei University. Pleasure to have you back, Professor Chung.
Thank you for having me again.
Dr. Yoo, the daily tally of local infections in recent days has been hitting numbers unseen since the start of the pandemic here in the country. What is your assessment of the current situation in the country, and what is your forecast for the days ahead?
Well, I was wrong because I'm expecting coming number is decreasing less than 500, but it's still coming close to 700 now. Even though this weekend the testing numbers goes down, but we can expecting it never goes down less than 600 till end of this year, because now everybody understood that this is COVID-19 virus in every corner in our Korean societies. So now we're try to tracing the number of the patients who are confirmed, but still we expected or not, but we knew that more than 3 or 5 times higher the number in the spreading in the society what actual we know. So unfortunately, at least until end of this year, we're going to see this similar curve around 500 to 600. I'm sorry about it.
I see. And Professor Chung, health authorities, as we mentioned earlier in the program, for their part, have forecast that the daily tally could surge past 900 starting next week. What are they basing this prediction on?
Well, actually, we know that yesterday we just hit like the number of 680, more than that. And then like this number of new cases over 600 haven't maintained for about a week. And this reproduction number, which we call R, is like 1.43 at the end of November. And now we believe that it has been over than that. But when we use this kind of conservative number into the predicted model with the rate of transmission, progression, or isolation and removal number, which was also calculated in the real world data, and then there were about 900 new cases has been calculated by that prediction model. And however, we have to understand that this is not a situation not considering the unknown route of infection, which has been maintained like 15% from the end of the November. So which means that putting together, it can exceed 900 daily new cases by the next week. So it is frustrating.
I see. Now, meanwhile, adding on to these concerns, a study in Australia shows the actual number of COVID-19 cases here in Korea may be more than double the official count. I have Dr. Stephen Phibbs from Ikigai Research over in Australia live on the line. Welcome, Dr. Phibbs.
Good afternoon. Thank you for having me.
Right, Doctor, I understand your study also estimates that the actual global count is about 6 times higher than the official tally. Please tell us more about your findings, including those for Korea.
So that's right. So we examined the spread of COVID-19 across a sample of 15 developed countries, including South Korea. We estimated across those countries that around 6% of the population, or around 50 million people, was infected. But most importantly, we estimated that around 6 times more people were infected than the official figures would suggest. Now, for South Korea, I've updated our results today. Now, our results are backward-looking, but I can tell you that as of around 10 days ago, we estimated a true number of around 81,000 infections for South Korea, as compared to an official number of 34,000 that day. So we estimate that around 42% of the infections are actually being detected in South Korea. And that was actually better than any other country that we looked at. And South Korea has done so well here because of the rapid and direct testing that it rolled out in the early days of the pandemic.
Right, and we're still working on it because numbers have been surging, Doctor. Dr. Yu, I believe you have a question for Dr. Phibbs.
Yes, Dr. Stephen Phibbs. So your research so impressed me. So as you know, the US CDC, they put on the similar report in last month. They say 8 times higher than the actual numbers. But this studies is gone with the antibody with the blood test, but I understood that your way of the study is different. Would you mind explaining a little more detail for us?
Absolutely. So our approach was actually based on data science. And what we do is we start with a number of reported fatalities for each country. And what we do is you work backwards from that to estimate how many infections must have happened in the past to give rise to a number of fatalities that we see each day. Now, we know, for example, that the infection fatality rate is around 0.7%. So around 0.7%, or around 140 or 1 in 140 people who catch the virus will go on to die later on. And we also know that the typical time from initial infection to death is around 3 weeks. So if we know how the fatalities have increased from day to day over time, we can work backwards from that, which we call backcasting, and we can work out how the true number of infections must have evolved over time. Now, one advantage of our approach is it's very simple. It also allows us to take into account the errors or uncertainty in our understanding of the virus. So, for example, whereas we know the infection fatality rate was around 0.7%, all we can say at this stage really was it was somewhere between 0.3 and 1.1%. So our approach is simple, it's evidence-based and doesn't rely on modeling, so it's an independent check on other sources of information. And in relation to that CDC study from the US, we estimated that the true number of cases for the US is between 3 and 8 times the official figure. So certainly our results are consistent with that US estimate.
Right. Dr. Phibbs, what would you say are the broader implications of your findings given the worsening global pandemic?
Well, what we found was the detection rate varied very wildly across countries. It varied from as low as 6% in the case of Italy to as high as 42% in the case of South Korea. But of course, if we're not detecting the infections, we can't plan ahead for what's going to happen in the future. And what we actually found, as well as the wide variation in the detection rate, was that there was actually a very strong relationship between the amount of testing and how many of the cases are reported. Now, that sounds really obvious, but the more you test, the better you can determine how widespread the virus is within the population. And that actually shows why the rapid and large-scale rollout of testing in South Korea has been so important. But from a policy point of view, this information is really important. We need to know how many infections there are so we can plan ahead and manage the impacts of that on the healthcare system, on society, and on the economy.
Right. All right, Dr. Phibbs, thank you very much for making the time to join us live at this hour with your insights.
Thank you for your time.
Professor Chung, how do you explain the gap between official numbers and the estimates calculated by Dr. Phibbs and his fellow researchers?
I think the biggest difference reason is due to the characteristic of asymptomatic infection itself, I think, because when the virus enters our body and if it makes the symptoms such as fatigue, fever, or cough, and then you can get the test, and then maybe the virus titer is high enough to be confirmed that you are having the COVID-19. However, when the virus enters your body, but you don't have any symptoms you're feeling, then you don't get the recognition that you have to go to get the test. So you still move around the community and transmission the virus to others, and that may be possible. And also, when happens that this asymptomatic cases go to get the test. However, the virus titer may not be enough for the confirmation of COVID-19 also, even though the virus is still getting out of the body. So I think this should be the major reason why there are some differences between the actual number and the prediction number we have right now. So if this is the matters, then back to the basic principle, I think for everybody, it is time to minimize the range of movement. And also, they have to thoroughly implement wearing masks and the washing hands and physical distancing. And so I think this is in the same context that the government wants to do, because on their principle, they are aimed to reduce the density of young people to gather at work or some specific schools or the common places.
Meanwhile, Dr. Yu, authorities here are working to expand their virus tracking efforts, but some believe such tracing efforts alone are insufficient. What are your thoughts on this?
Well, first of all, I'm welcoming the government to try to make the screening center to every corner of the province, also each district in the Seoul metropolitan city. I'm welcoming about it. But we have to see the 3 points. First, who's going to do? Nurse, doctors? Yes, we can do. But we are facing on the shortage of hands. That time we can consider who are retired nurses, and clinical laboratorician can do under the regulation of Korean Ministry of Health. The second, so there are how to do, the way of do. We thought that the rapid kit test is the easy way to go, but the same thing I can show. We are getting the sample from the big deep on the nursery, same way the RT-PCR and the rapid kit, same way. And the other one is saliva. But the accuracy is a little different. Anyway, we want to do some to expand it, but the problem is, third one is the people are worried about stigma. If I got it, how I can overcome and compensate my job and my life and all who are linked with me. So we have to figure out and make it clear to the facility who are going to do it from the next week. At the same time, we have to make it clear for the people who really want to do the test. That time we can trace it more easier.
Professor Chung, in response to shortages in hospital beds, authorities in Seoul are setting up modular isolation wards made out of shipping containers, I believe. Some are casting doubt on the practicality of this measure. What are your thoughts?
Yes, actually, in order to operate this kind of container bed, it has to be premised that the negative pressure device should be well equipped. So to prevent the spread of the virus during the treatment, I mean, this separation between the area of the medical staffs and also the area of the confirmed cases, I mean, they should be separated also strictly when we have to apply this container bed. So there are some consideration about the effectivity. And also because of this reason, people are considering about other options such as the modular hospital or building a bed in gym or convention center. However, they are also questioned for their effectiveness. So, I mean, right now, I think there is no definite answer to that. However, in my personal thinking, I think making the new systematic criteria for people who got the COVID-19 diagnosis, they have to make the severity assessment first, I think. And when you are young and you don't have any kind of comorbidity and you have just mild symptoms, then I think you can just stay home and do some home monitoring from the medical staffs regularly. However, when you got the COVID-19, however, you have a high number of comorbidities such as hypertension or diabetes or cardiovascular symptoms, and you also have the high risk of mortality, then you should get the priority of getting the bed and also have the priority to get the medical resources. So I think this overall systematic allotment should be made first.
Are we only facing a shortage in supplies and not a shortage in workforce, medical staff?
We are all facing both of the entire medical resources deficit.
I see. Dr. Yu, also to address shortages in supplies, there is talk about shortening the quarantine period for patients from the current 10 days to fewer. What are your thoughts on this?
Well, first of all, I 100% agreed about the Professor Jung Hee mentioned about it, because we need this kind of agreement. We can call guideline of the admission, guideline, and the taking the ICU bed. And at the same time, let's see, compared to the immigration quarantine for 14 days, even there are no symptoms, but who had got the positive and no symptom, who suspicious, for 14 days we talk about it, but now we can tell you can go to 7 days later because you are fine. Anyone can understand about it. So we need the setup of the new setup can make the all person can understand. So, but clinically, in the medical evidence based, so depend on the patient, depend on the person, and decision of the clinician who take care of the patient, who said, now you can go, yes, you can go. Why? Characteristics of this COVID-19 virus and depend on the patient's condition can be different. So we don't need the complete 14 days to stay in the hospital and taken, because we have to give it away to who need urgently. That's 100%. But people cannot understand about it. So we are facing as like the clinician, everybody blame to the clinician like me attend in the real field. So let's make the kind of category like the guideline to admission, and the first priority to take the bed is ICU or normal bed or triage center is like the facility-based services, and who can stay at home at the time. Let's set up the guideline first and make them to understand well, and then probably we can understand. Even the short 5 day, 10 day, 7 day doesn't matter.
And talking about staying at home, Professor Jung, some patients in the capital region have been asked to wait at home given the lack of hospital beds. What precautions should they take to ensure the safety of those they live with?
Yes, actually we had the bed utilization over 90%, so there are some people who have to stay at home as long as 3 days, I know. And actually in that situation, there is no exact instruction yet. However, I think it's better not to eat and talk together with the other family members. And I think if it's possible, please use the bathroom separately. And also, some say that using masks inside the house can help this separation too. And also, this washing hand frequently will also help this kind of safety.
Right. Dr. Yu, over in the UK, 2 healthcare workers reacted adversely to the first dose of the Pfizer vaccine, and officials there are warning people who have a long history of allergic reactions not to seek the vaccines. What are some of the general side effects that we can expect from COVID-19 vaccines?
Well, generally flu vaccination, seasonal flu vaccination makes ouch, aching, little bit of fever, headaches, dizzy, and short breathing because of afraid of the needles. Anything can happen, and scratching. But SAE, serious adverse effect, is the increased mortalities and unrecoverable, incapable this is kind of serious adverse effect. But until now, we don't have it because just a needle and kind of, outside, we put a foreign body to our bodies. Everything can happen. It's kind of allergies. Don't feel afraid of these allergy reactions first from the beginning of the vaccination from UK and others. So our dear audience in the Korean audience, please listening. This vaccination will be good and safe for a couple of months later, and then we'll be sure. I'm so appreciative who are challenges. First stage having vaccination. I really appreciate your challenge and your volunteers, but we will watching about that there are serious effect, adverse effect or not, and then we can recommend for you all. But now we are safe still.
Right. Professor Chung, we are looking ahead to the weekend again. Could you remind our members of the audience about things to be careful about to ensure safety for themselves and for those around them?
Yes, as I told you before, we are facing the problem of asymptomatic infection, so maybe people are not sure they have the COVID-19 virus or not. So the best way is to reduce your range of movements, maybe. And if it's possible, please stay home and please stick onto the guidelines that we know is that wearing masks, washing hands, and making the physical distances 2 meters or more is our best way to protect ourselves.
Right. Very briefly speaking, Dr. Yu, your words of advice for the public this weekend.
Well, so people are now tiring, and also these days, so entrance exam is going to college, all nationwide in Korea. Please help them because they move around 400,000 people all over the nation of Korea and their family and companies. So I want they be completely finished in the safely. They need our help. Please put the mask and stay safely at home and watching the news. But it's a real true news, but please close your ear from the fake one.
Yes. Right. All right, Dr. Yu, as always, thank you for your thoughts. And Professor Chung, thank you for being with us today.
Thank you.
Right, and that brings us to the end of this week's coverage of COVID-19. The forecast for the week ahead is looking quite grim. So do your part to keep the virus or spread under control by staying at home if possible. In the meantime, do take care. See you on Monday.
As many experts have warned us since the beginning of the COVID-19 outbreak, the situation is indeed getting worse in the cold winter season. A curve is rising steeply all across the world, the US, Japan, Europe, and even Korea. A resurgence seems inevitable this winter, which means for everyone's safety, we need to follow stricter measures and refrain from holding year-end gatherings.
The virus spreads quickly in cold and dry weather. The number of untraceable COVID-19 cases is on the rise, triggering a series of infections in the daily environment. Winter is the season for indoor activities and gatherings, but we've arrived at a pivotal point in the fight against COVID-19.